Edutainment Studios welcomes you to On Bended Knee, Problems with Your Knees. This module is part 1 of a 7-part series on knee problems. A knee problem is often caused by an injury to one of the 3 bones, ligaments, tendons, cartilage, or the bursae of the knee joint. However, there are many other causes as well. Some people are more likely to develop knee problems than others. Many jobs, sports, and recreation activities, getting older, or having a disease such as osteoporosis or arthritis increase your chances of having problems with your knees. In this course, the objective is to help you learn the basic information about what the knees do, know who can be affected by knee problems, what causes knee injuries. The knee is the largest joint in the human body and is considered to be the most complicated one. It is composed of the lower part of the femur, the tibial plateau, and the kneecap. It enables both a hinge and rotating movements as the connection between the upper and lower leg. This means that as humans, we can not only bend the lower leg backwards, we can also rotate the lower leg and foot towards the upper leg. The knee joint function is to be fairly flexible while walking and bending, but at the same time, it is supposed to offer great stability while standing up. There are 2 menisci located between the upper and lower leg bones in each knee, one on the right and one on the left side. The kneecap is located on the anterior side of the knee. It is embedded in the tendon of the thigh muscles. The kneecap serves as the transmission of force, while extending the knee and protects its internal regions of the joint. The knee joint is surrounded by a joint capsule. This capsule is lined internally by a mucous membrane, which produces synovial fluid, also known as synovia. It must be present in sufficient quantity and in the required consistency. Like most articulating joints, the opposing bone areas are covered by a layer of cartilage so that the desired knee joint function is properly fulfilled. This smooth, firm, and elastic layer ensures that the knee moves easily and without friction. The major constituent of the cartilage is water, and only 1/5 is composed of collagen fibers. Healthy cartilage is like a sponge. During compression, metabolic products are squeezed outward, and during relaxation, nutrients are pulled in. This is how the cartilage is nourished, since it's not supplied by the blood vessels. 2 intersecting ligaments are located in the center of the knee joint, the anterior cruciate ligament, or ACL, and the posterior cruciate ligament, or PCL. Both of these ligaments have significant importance for the stability of the joint. Additionally, the medial and lateral ligaments of the knee function to precisely guide through the full range of motion of the knee. Aside from that, adequately trained muscles are quite imperative for good knee joint function. They also ensure support and stability. Muscles that are too weak often lead to knee problems. Anyone can be affected by knee problems. Men, women, and children can all have issues, and they occur in people of all races and ethnic backgrounds. A knee injury can affect any of the ligaments, tendons, or fluid sacs, called bursae, that surround the knee joint, as well as the bones, cartilage, and ligaments that form the joint itself. Some of the more common knee injuries include ACL injury. An ACL injury is the tearing of the anterior cruciate ligament, or ACL. This is one of 4 ligaments that connect the shin bone to the thigh bone. An ACL injury is particularly common in people who play basketball, soccer, or other sports that require sudden changes in direction. Fractures. The bones of the knee, including the kneecap or patella, can be broken during motor vehicle collisions or falls. People whose bones have been weakened by osteoporosis can sometimes sustain a knee fracture simply by stepping the wrong way. Torn meniscus. The meniscus is made up of tough, rubbery cartilage and acts as a shock absorber between the shin bone and thigh bone. It can be torn easily if a person suddenly twists their knee while bearing weight on it. Knee bursitis. Some knee injuries cause inflammation in the bursae. This is the small sacs of fluid that cushion the outside of the knee joint so that tendons and ligaments glide smoothly over the joint. Patellar tendinitis. Tendinitis is irritation and inflammation of one or more tendons, which are thick, fibrous tissues that attach muscles to bones. Runners, skiers, cyclists, and those involved in jumping sports and activities are prone to develop inflammation in the patellar tendon, which connects the quadriceps muscle on the front of the thigh to the shin bone. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of 7 on knee problems, and come back to join us for part 2.